Hi, I'm Dr. Nathan Kwablah, and this is Real Health Revealed. I hope you are keeping safe by wearing your mask, performing hand hygiene or using a hand sanitizer, and of course, observing social distance. Today, we are going to talk about COVID-19 vaccines, a topic that has got a lot of people anxious and questioning whether they should get the jab or not. Let's break down the topic. So it's been over a year of COVID. We've looked at so many preventative measures, washing of hands, and all the other protocols that we know. But finally, the vaccine is here. And I think it's important for us to understand what these vaccines are here for. Now, the vaccine is something we give to you to help prevent you from getting very ill or death, or even getting the disease, which is COVID, at all. Now, a COVID vaccine comes in different forms. Currently, there are about 3 major types available. We have what we call the mRNA type, which is being produced by Pfizer and Moderna. And then we have what we call the viral vector models. And then we have the subunits of the virus type. Now, these are 3 main types, but under each of these types of vaccines, different companies are producing their own brands of the vaccine. So for the mRNA, we currently have 2 companies, Moderna, Pfizer. Under the viral vector, we have a whole number of them. The most common ones, the Sputnik V, the AstraZeneca, and then also the Johnson & Johnson's. And then we also have what we call the subunit of the virus, which is being produced by Sinopharm and other countries. So these vaccines, what they do is, when you get the shots, they instruct or teach your immune system how to be prepared to fight the COVID or the SARS-CoV-2 virus when it gets to your body. So think about it this way. You have your defense system, which are like soldiers or like the police, but they are, just generally skilled. They only know how to fight a few type of criminals. But then they have just heard about COVID-19. And so the bosses teach them, or bring in a vaccine, or bring in trainers to teach them how to fight the COVID-19 virus when it gets to the body. So this is what the vaccine does. It trains your immune system, which are the soldiers or your defense system, on how to fight the virus when you encounter it. Currently in Ghana, we have 2 different brands of one type of the vaccine. We have mainly the AstraZeneca or Oxford vaccine, and then also the Sputnik V vaccine, which was produced by Russia. Now, the technology these 2 employ is that they have a little detail in a virus coat, a harmless virus coat that is sent by the injection to your body to instruct your body on how to defend yourself when you get the virus to your body. So what do you need to do before you get a COVID-19 vaccine? Most importantly, I advise you to read a lot about the vaccine and the virus so that you are well informed. Talk to a doctor or a healthcare professional to give you sound advice as to whether you qualify or not. Now, when I say whether you qualify or not, this applies to the people who are appropriate for the vaccine. Now, in Ghana right now, we are giving it to everyone above the age of 18. However, over the next couple of months, it's going to be given in phases, in 3 main phases. The first phase, we are giving the vaccines to healthcare professionals. We are giving it to frontline security servicemen, frontline government officials, people above the age of 60, and people with comorbidities. These are people who have diseases such as hypertension, diabetes, or cancer, including sickle cell as well. And then it moves to the second phase, where we are giving it to essential workers, such as people working with ECG, the Ghana Water Company, teachers, and other essential workers. And then following that, we have the third phase, where we are giving it to everyone else above the age of 18. However, it's important to note that in Ghana right now, we do not advise the the vaccine to be given to people who are pregnant or who are planning to be pregnant in the next couple of weeks. Also, you should note where in your area the vaccine is being given, and also know when this vaccine is being given. So there are different times over the next couple of days, and you can get this information from the appropriate resources. Definitely, if you are also not feeling well or you are sick, you should not take the vaccine until you are well. It's also important for you to know that the vaccine is free. No one should pay for this vaccine at the moment. So if you've had COVID-19 already and you've recovered, do you still need the vaccine? Yes, the advice is that you should get the vaccine. We do not know how long the protection you get from getting the infection will last. But however, we know that the vaccine, once you complete it, will protect you and give you longer lasting protection. So you should get the vaccine. Ideally, yes. But most importantly, the vaccine will prevent you from getting the severe form of the disease and prevent death. Most of the vaccines available are concentrating or are most importantly giving you that advantage. Some people might get a mild form of the disease even after taking the vaccine, but then they won't get the critical or severe forms and definitely will prevent them from dying. So, if you want to have a baby one day, is it safe for you to get the vaccine? Of course, yes, it is safe for you to get the vaccine. However, if you are pregnant now or you are getting pregnant in the next couple of weeks shortly after taking the vaccine, you shouldn't take the vaccine. So just like any other vaccine or any other medication, the COVID-19 vaccine has some side effects. After taking the shot, you will feel pain at the site of injection. You might also get some swelling where the jab was given. Now later on, or a couple of hours later, you could have some headaches, you could get fever or chills, body aches, fatigue. It could actually even prevent you from going about your daily activities for about 24 to 72 hours. However, these symptoms should go away. Now, what do you do when you have these symptoms? As simple as it is, you can get some anti-inflammatory or anti-pain medication, something as simple as paracetamol, and this can help to reduce the fever, the chills, the body aches. And then it's important for you to get some rest, just so that that fatigue and muscle aches can also ease off. Now, you can also tepid sponge, that is applying a damp cloth to your skin if you have a fever. And as I said earlier, get some rest, eat well, and you should make it through the side effects with no problems. Yes, the COVID-19 vaccine is safe for breastfeeding women. Currently, studies have not shown that the vaccine or the antibodies that are produced will cause any harm to a baby or a child who is breastfeeding from the mother. So yes, you can take that vaccine. So what do you do after taking the shot? First of all, your vaccinator is going to ask you to wait for 15 minutes. This is to make sure that you don't have any untoward or serious side effects from taking the vaccine. Next, your vaccinator will let you know when your second shot is going to be. Most of the vaccines available now will require you to take 2 shots. There's only one vaccine in the world that needs only 1 shot. So please make sure you take note of your next shot and the time interval between that. Now, after you leave the vaccination center, you can go about your daily duties or go home. When you experience any side effects, especially fever, chills, body aches, headaches, or weakness, make sure you rest and you can take some paracetamol or any other analgesics or pain relief medication to help quell or quiet those side effects. And then you make sure you make it for your second appointment for the second shot. Make sure you don't stop the COVID-19 protocols that are already in place. You need to make sure you keep those up. Wearing the mask, hand hygiene, and social distance. I hope I've answered most of your questions on this special COVID-19 vaccine episode. If you have any more questions, please comment in the section below or follow the conversation on social media. It's been me, Dr. Nathan Kwablah, on Real Health Revealed.